it's really messing up with my spring break. What is there to do here other than go to the bars or the beach?
I mean, it sucks, but we're going to make the best of it.
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying. You know, we've been waiting for Miami spring break for a while. The bars and restaurants are closed, but we'll find ways to have fun.
We've all heard the call for social distancing, right? Perhaps it wasn't loud enough for some young people who are still converging on the beaches of Florida for spring break. Now, the state governor, what does he say? He says he's not going to shut down beaches amid the outbreak. However, some local authorities are closing beaches to fight the spread of COVID-19. The total number of cases in the U.S., it is now nearly 9,000. That's an increase of more than 40% in just 24 hours. The virus is in all 50 states, and health officials are increasingly concerned about the cavalier attitude, and we just saw some of that some young people are displaying toward COVID-19. CBC's Katie Simpson is on the story live from Washington. So public health leaders, Katie, what are they saying about the spread of the disease and the risk of illness?
The number one piece of advice that Americans are getting, as Canadians are, is the best way that they can deal with this is to obviously stay home and social distance. And in some major cities across the United States, that is happening. We're seeing images out of New York City of Times Square being completely almost deserted. In San Francisco, there are shops that are closed. There's a shelter in place there. Here in Washington, it is pretty quiet. People are listening to that advice. But again, in Florida, those images of spring breakers out still enjoying the beach, still out partying at bars that are open. That is a major concern for public health officials in the United States. And so there was a direct appeal to millennials, young adults from top officials at the White House, including the president, for these people to start listening to the advice, saying it's not just about you.
We don't want them gathering, and I see they do gather, including on beaches and including in invincible. I don't know if you felt invincible when you were very young, but they were feeling totally invincible, or are feeling that way, but they don't realize that they can be carrying lots of bad things home to grandmother and grandfather and even their parents. So we want them to heed the advice.
Public health officials have spent a lot of time talking about how important it is to protect the vulnerable, the elderly, because they are at the highest risk to have serious consequences as a result of this virus. But yesterday, the White House went out of its way to point out new information that's coming out of Italy and France that shows more people under the age of 60 are contracting this, and they are having serious cases, really pointing out that the science around this is still in flux.
And Katie, Americans are bracing for a spike in positive test results. Walk me through what's behind that, because I'm wondering if the general public, and yes, we saw some young people, but the general public is following those recommendations to stay at home.
Well, there's certainly going to be some sobering information from public health officials down here, because that backlog in testing that has really hampered the American efforts to get a grip on this thing, that is starting to ease. By no means are there enough tests in the systems. We are still hearing anecdotal stories and stories from frontline workers that people who think they need to be tested can't get tested because they don't have enough. However, there has been a rapid expansion of tests getting out into the market, and so over the next few days, health officials, including Dr. Deborah Birx, who's on the U.S. task force, coronavirus task force, they are warning people, because there has been more widespread testing, those numbers are going to spike.
There was backlog. There were individuals who had been tested, who hadn't had their specimen run because of the slow throughput. It's now in a high-speed platform. So we will see the number of people diagnosed dramatically increase over the next 4 to 5 days.
The experts are saying there's going to be the curve that everyone talks about, flattening the curve, and the curve of cases, that gradual incline, that it is really going to jump in the United States, and it won't stabilize for the next 4 to 5 days because of that influx of results coming in.
Thanks for that, Katie. We'll talk again. CBC's Katie Simpson in Washington.